Hello, welcome back to the Mental Health and Addiction YouTube channel. I'm Justin, and this is episode 13. I was actually initially going to just make this a quick update about me, but it is about mental health and addictions, so it's an episode, and it's episode 13. So, I got some news, some medical news about MRI results. And my complaint was that I've been having memory problems and have been having difficult time thinking and concentrating. So they did a CT scan on me first, which I really didn't think would show anything, because that's just basically showing if you've got a dent in your head, pretty much, I guess, like bigger structures. So I didn't think it was that. And they went and did an MRI afterwards, because that came back fine. And I didn't hear from him. So finally I was just like, I guess I ought to make an appointment to figure it out. Go ahead and get my results so I can figure if we need to do another test or whatever, because I know something's going on. So I called and scheduled a Zoom telehealth appointment by video conference. And I actually missed the appointment because I forgot. One of my complaints about things is I forget. So they actually called me back about 25 or 30 minutes after my appointment time, and I was like, oh yeah, I forgot, I'm sorry. And they went ahead and offered to do it right then, if I could do it right then. And so I said, oh yeah, sure. Which I thought was, I didn't think a whole lot of it at first, but I started to once I was like, well, they did just call me back. They've never done that before if I missed an appointment. So maybe he was reviewing it before my appointment and he wanted to tell me something. Anyway, that was what was going through my mind. So it's a little bit nerve-wracking, anxiety-provoking MRI results read to me by my primary care physician by a Zoom video telehealth video conference thing. So I have, in the right hemisphere of my brain, several, I don't know how many, but it was plural, multiple, it sounds like there's, it's more than just 2 or 3. It sounds like there's a lot. There are cysts that are about 2 to 3 millimeters, from what they could tell, in my right hemisphere of my brain, and it also does affect an area that controls memory and stuff. So, I was just kind of quiet listening to him because I didn't really know what to say. It was kind of, I don't know what I expected to hear. I guess I expected them to just be like, nope, everything's fine, looks fine again. And, it's difficult because you want to know what's going on, but at the same time, you don't want it to be something really bad. And I don't know if it's really bad, but cysts in the brain don't sound good. So I've been reading a little bit about cysts in the brain, which, yeah, I've been doing that. But so before I did that, though, when I was on the video conference with the doctor, he said that he didn't want to jump to cancer. I didn't bring up cancer or anything like that. I just let him talk. And so he said that, and I'm sure he said that because people would probably just be like, oh my God, is it cancer? Which was kind of going through my mind a little bit, but I just wanted him to talk because I wanted to hear exactly what he thought it could be. And so he said it could be that, it could be hereditary, either Alzheimer's or dementia or early onset type stuff, because I'm 40 years old. So of the types of cysts that there were, which I didn't know there were this many kinds, I printed this from Cedars-Sinai Hospital or whatever.com. Brain cysts. What is a brain cyst? A brain cyst or cystic brain lesion is a fluid-filled sac in the brain. They can be benign, which are non-cancerous, or malignant, which are cancerous. And benign also means that the growth does not spread to other parts of the body. A cyst may contain blood, pus, or other material. In the brain, cysts sometimes contain cerebrospinal fluid, called CSF, which is clear liquid that bathes and cushions the brain and spinal cord. Some brain cysts begin before birth. I don't think that's the case with mine. Even if a brain cyst is not cancerous, it can still cause problems. It may press against brain tissue and cause symptoms such as headaches, vision problems, nausea. If this happens, you may need surgery to remove the cyst. In some cases, if the cyst is small and not growing and not likely to cause symptoms, your healthcare provider may advise watching it instead of surgery. There are different types of brain cysts. Arachnoid cyst is also known as a leptomeningeal cyst. This is a cyst between the brain and the arachnoid membrane. I don't know what the arachnoid membrane is. I probably should look that up before I got on here. This membrane is one of the protective coverings around the brain. An arachnoid cyst contains the CSF fluid, brain fluid. And these appear most often in children, but they may also happen in adults. This type of cyst happens more often among males than females. And that's an arachnoid cyst. A colloid cyst is a gel-filled cyst often forms in one of the 4 ventricles of the brain. The ventricles are the reservoirs for your cerebrospinal fluid. This is not where mine is. Dermoid cyst is a rare type of cyst. It forms when fusin cells get trapped when the brain and spinal cord form before birth. That's not me. Epidermoid cyst is called an epidermoid tumor, like a dermoid cyst, the above one I just read. It forms, gets trapped when the brain and spinal cord form. Okay, it's not me. Pineal cyst happens on the pineal gland in the middle of the brain. I already know that's not me because mine is not in the middle of the brain. Mine's in the right hemisphere, multiple spots. And so that leaves 2, and I believe the next one is probably what mine is. Brain abscess happens anywhere in the brain as a single cyst or multiple cysts. Abscesses are usually caused by a bacterial infection and sometimes caused by a parasite or fungus. And I'll go ahead and mention the last one is a neoplastic cyst, is due to a benign or malignant tumor. When a brain tumor starts outside the brain, it is called metastatic. Anyway, that's not mine. That leaves basically brain abscesses and possibly one of the other, like an arachnoid cyst or a colloid cyst, but those sounds like, no, it's not a colloid cyst, it could be arachnoid cyst, but even that doesn't sound right. It sounds like it's got to be closer to a brain abscess. And when you look at brain abscesses, let me find it. Well, the brain abscesses are scary. If left untreated, complications can include infection of the bacteria that's in the cyst, because it could be caused by bacteria or parasites or whatever. So if it were to burst, it can risk causing an abscess, which is worse, a little, I guess, different than the cyst, but the abscess, it can risk basically septicemia and blood poisoning if it bursts. And whatever I have is multiple of them. It could, and I also read that it could be related to any kind of bacteria, parasite, or fungus, as I mentioned. And they also mentioned endocarditis, which I was a heroin addict. I shot up quite a bit. I've shot up in veins here, right along out. So that could have happened, that it got in. And of course, I missed before there, even. Once I missed really bad, and it went, I believe, into my lymphatic system. So, and that burned like hell. So that could have caused something. And there's also obviously many other times that I've had like an infection from, sticking a needle in me. I've had infections in the past, and I've had many places on my body, like, you can kind of see there. Well, this one's better. You can see there. It's right there. You can see it on my hand. I've had, places on my body that have scars, like even here on my shin. There's a vein there. Anyway, so those are risk factors. Weakened immune system would be a risk factor for getting brain abscesses or cysts. Poor health care, poor sanitation. I did have an HIV test, which was non-reactive, which means negative. A scary thing that I read about brain cysts is that the fatality rate is 20%. And that's, it has fallen to 20% in recent years from 50%. And, they also mentioned toxoplasmosis as a possible thing. So, lots of fun stuff. What can they do for this stuff? From the stuff I looked up, small cysts like mine are typically watched. If they get bigger, they can do surgery or shunts to drain them. If the cysts burst, break open, or bleed, they can cause potentially serious problems requiring emergency treatment. The cysts may cause memory disturbances, behavioral problems, issues, or changing in behavioral in your behavior, I guess, or in different types of memory disturbances. Sometimes, I guess, could cause a tumor, but I don't think that's the case with mine necessarily. Not a big tumor anyway. It could be a few little ones. I don't know. But some of the side effects I've been having that I've noticed are nausea, vomiting, which I am occasionally getting sick like that. Headaches. I don't get bad headaches, but I do get them sometimes. And I've also been I've been feeling very dehydrated a lot. Seems like it's hard for me to keep, just get enough water in me. I don't know if that has anything to do with this, but being dehydrated a lot probably isn't great for the cysts in my brain. Anyway, so that's episode 13. And I'm calling this an episode because it does have to do with probably my drug use. Has to do with a little bit of, who knows if stress could cause it, or, when you're diagnosed with, or not even diagnosed, I don't have a diagnosis, by the way. I just have been told I have cysts in my brain. It's just what the MRI showed. I'm getting a referral to a neurologist, which I don't have an appointment for yet. So maybe I'm doing this video for myself, but maybe I needed to talk about it somehow. But that's what's happening with me, and as long as I can do everything here that I can do, I'm not going to go anywhere. So please subscribe. Please share Mental Health and Addiction channel on YouTube with as many people as you can. I need more subscribers, and I want to hear from you guys. I want to talk to you guys. I want to get some dialogue going. I've talked about this before in the past when I kind of first started doing this, and I've got a few comments here and there, but I really want this to be shared, and I really do want to be able to talk to some people who are struggling in any way with mental health or addiction, in any way that I could help them with my experience. Because I can definitely help people hopefully avoid going through some of the experiences that I've gone through. So thanks again. Please subscribe and share, and wear a mask. How about that? Bye.